give us
I think,
a sign.
good afternoon.
I don't think he hadn't given you a sign yet. Okay, we're live.
Okay. Good afternoon. I'd like to welcome everybody to this Pitt County Department of Social Services Board meeting. Today being August 10th, 2021. I'm going to call the meeting to order now, and we're going to start by observing a moment of silent prayer or silent meditation. Okay, thank you. In terms of our agenda today, Susan, we have anybody for public comment?
No, sir.
Okay, thank you. And so I will need a motion either to adopt or to revise today's agenda.
So moved.
And could I have a second?
Second.
And all those in favor say aye.
Aye.
Aye. And you should have received a copy of last month's minutes. So we'll need a motion to approve or any additions or amendments to those. Have a motion?
Move to approve.
Okay, and a second.
Second.
Thank you. All those in favor?
Aye.
Okay. Moving on our agenda today, next, kind of a standardized thing, kind of a fun thing that we've started probably about a year ago, I guess, is in terms of recognition of new hires. And so this is not meant to be any pressure. This is a fun thing, if you can imagine, but just gives us an opportunity to meet you and hear a little bit about you. So Jan, I'm going to turn it over to you.
Okay. So, yes, so what we're going to ask you to do is, when I introduce you, is come to the podium.
No pressure.
No pressure. And tell us who you are, a little bit about when you started, kind of where you came from, something fun about yourself, okay? So tell us those things. And so I'm going to start with Cammie. Cammie Brown in redetermination is going to come forward. Sorry to put the pressure on you. There's the podium over there.
This is a fun thing.
Yes.
As you stated, I'm Cammie Brown. I'm excited about being here. I am a Pitt County girl. I grew up here. I went to ECU and Pitt Community. So I'm excited about being here. I'm nervous.
And while she's getting ready, Cammie's in our redetermination section.
Gotcha. So what does that mean? What is redetermination?
I am taking in the Medicaid applications.
Gotcha.
And so with that, I'll be looking over the ones that have already been taken in, but I guess I'm doing like the dates, so I'm recertifying all of the
Okay,
applications.
thank you.
And what day did you start?
I started on Monday.
Yeah, see, so that was a really tough question you asked her.
And today is Tuesday, so well done.
Thank you.
Thank you very much.
Welcome.
Okay, so now Joy saw how it was done, and so Joy Moore, come on down. And I'll help her a little bit while she's walking to the podium. Joy's in our customer care unit,
Okay.
so she's going to be meeting and greeting folks.
Hi, my name is Joy Moore. Originally from Hampton, Virginia. I've lived in Pitt County for the last 8 years. I do love the area. I have been in the banking industry for a little over 30 years and making a change. And was hired and started as of yesterday
Ah,
as well. And I will be an income maintenance caseworker 1, which is a part of customer care and getting information from clients.
thank you.
Thank you.
Welcome, welcome.
We're excited to have both of you. Stacy Dory also recently started. Stacy is a social worker in our APS unit, and Stacy is out doing APS work this afternoon as we speak, so could not be with us. So glad these two could come.
Absolutely, and you're welcome to stay, or if you have other things to do, you can leave. So, but we appreciate you coming, and on your second day, that's pretty impressive. Thank you.
They came back a second day, you know. So thank y'all.
Thank you. Okay, moving along here, items for discussion. As we talked about last month, we've invited Ms. Florida Hardy to come today to give us I guess, an orientation overview in terms of the news that we had last month, that Ms. Stan is going to be retiring in December. So if you recall, the little red books that we got in terms of one of our major responsibility as board members is to hire the new director. So we're going to be busy with that over the next number of months. So we thought a good place to start would to have Ms. Hardy come and talk with us about kind of that process and how she can help us with that.
Okay, sure. And as you said, I'm here to help you.
Yes.
So however you all want to do it. Basically, we do typical recruiting. We advertise in the typical places, local paper, with employment security. And then we have a long list of folks that we send, who've requested our job vacancy, so we send it out to them each week. Then we go more specialized for certain positions. In this case, we look at the DSS listservs. We look at, we tap into also UNC's School of Social Work, so they get a copy of our job vacancies. We can go other places if you need us to. North Carolina Association of County Commissioners have a website, statewide, nationwide. So if you want to look statewide, that would probably be sufficient. You probably wouldn't want to go national with NACO. So, and then any other places that DSS thinks we can reach those candidates, because we want to make sure we can draw in all the candidates that we can. So locally, local paper, the county's website, which is where we're getting most of our applicants now. People have gotten attuned to our website and are visiting county's website. We do get some hits from the local paper, but I think that listserv for this position is going to be the best thing. It's going to be great, and Susan can help us with that. We'll get the advertisement ready, pass it on to Susan. She can get it on the listserv for us, and I expect that's probably where we get most of our candidates. So, and I understand that Ms. Elliott has already talked to the county manager, and it's going to be released for advertising in September.
Right.
And depends on how long you all want to run it. So we can start advertising in September. Our typical mandate is 7 days, so we typically advertise for 7 days. Then anything else further, if you want to go that far. Probably about 30 days, I understand, is what you're thinking. So so when the applications come in, we'll collect them for you. And then at that stage, we can do one of two things. We can screen them for you, or we can pass them all on to you all. Because we're expecting to get a lot. We hope we get a lot. But we can either screen them for you and just go with the minimum qualifications that are set up by the state and screen out those that don't meet the minimum qualifications, or if you prefer, because you do have the authority to appoint this position, we can pass them all to you for your review. If we get a lot, you might want us to let us help you out and screen them for you. So you only get those who meet the minimum qualifications. And then after that, I'll help you any way you need me to get through your interview process when you set those times up. So just let me know. And if there are places, I'll help you draft your advertisement. I would expect if we're going to go out to other places, we would have something a little larger than what we put in the paper here. So I'll be glad to do that for you, help draft the advertisement, have it prepared. You meet again in September, so we would be done before that to get out for the advertising. Any specific questions for me?
Yeah, questions for Ms. Hardy?
No, ma'am.
Sure? Okay.
So, yeah, I'm just kind of processing through here. So, the work that we need to do now, between now and the time that we post the ad, we have to get the advertisement together.
Yes.
Okay.
And we primarily pull that information from the state, from the state job specs for those positions. And then we add in some other things, maybe about the local DSS department, population size of the county, and some things about social services, so that people will have some basic information about this particular social services, so they'll know what they're applying for. But we can draft something for you.
Is that something that you could draft
Sure,
and help us with?
absolutely, and get it to Jan or
With a-
Susan
with a-
so that you
with
all
a-
can see it.
Okay,
Yes,
with a
absolutely.
target of beginning the posting September 1st? Is that-
Yes.
Or thereabouts, yeah.
Or
If we can,
thereabouts.
if we can do that. And we've got the posting we did for the deputy director.
Okay.
So we could maybe even use that as a starting
Starting
point to pick
point.
some things.
Just change the minimum qualifications and
Mhm.
those requirements, yes. And the information about Pitt County would primarily be the same. So,
Wouldn't have changed much.
Mm.
That's
No.
right.
So Florida, I do have one question. So
Sure.
if we decide to have an interview committee,
Yes.
if we have more than 2 people, does it fall under the public meeting law and we have to?
If this full board is going to interview, I
Uh-huh.
would say yes.
Yeah,
If the
okay.
full board is going to meet, yes.
Yep.
Thank you.
Which would mean you would have to, publicize the meeting, open the meeting, go into I'm having a moment here, go into the private
Closed.
session,
Closed.
closed session, see, that's the word I was looking for, go
It
into
was there.
closed session, and, then come back out of closed session, and we could discuss how you would move on to the next, the next interview, because there are several ways you could do that, but, yeah, you'd have to advertise and go that route.
Yeah, and I guess the other thing to consider too is how you all want to receive the applications. Are you going to review them as a group, which would then also be a meeting, I guess, of the full board. So if you want to review them as a group, so you need to decide that before you set up your interviews, because you want to go through and see which candidates you are going to interview, to select your candidates. So, but once the job is closed, we'll let them, Susan will know that the job is closed, and then let us know how you want to receive the applications.
Do you have an idea how long it's going to take for you to put together a draft of the post?
Not long, a couple days. If you're ready for that soon, yes, because that was a great suggestion from Jan, that we'll pull the old one from the assistant director position, deputy director position, and just change some of the language. The state pretty much writes those job descriptions for us because they have certain criteria in those job specs that must be in that job description or in the advertisement, so. But we'll just pull in the Pitt County information to beef it up some. So just a few days.
I will send all of y'all the current job description. I'm trying to work on revising it because it hadn't been updated in a while, but the basic information is correct. So that would give you some thinking as you, move with this.
And typically, one of the things that applicants do want from us when they start applying for the job is a copy of the job description. So that
Absolutely.
would need to be updated. And I like it when they do request a copy of the job description, so.
So I guess our work as a board, we've decided today that we would go ahead and look towards September 1 or
Okay.
thereabouts to begin the advertisement. And I guess our work as a board is to figure out kind of how we want to run the process.
Yes.
And that's our responsibility in terms of things. And if we have more than 2 people, board members, that would constitute an open meeting. One of the things I thought about is maybe having a 2-phase process in terms of doing some screening and then opening it up. So I think those are the types of things we probably need to talk about, so.
And I will be glad to help you wherever you need.
Okay, thank you very much.
You're quite welcome. Have a good afternoon.
So anybody have any thoughts about that, or do we want to discuss that now? We want to, because that's certainly by next board meeting, we're going to have kind of a plan in place in terms of things.
It'll
So,
be halfway through the month by that point.
correct.
You won't have any applications, though, until the end of the month if you post for 30 days. And then she's got to review them assuming you want her to review and at least do the initial screening. It will, take a couple of days to get that done, depending on how many applications you've got. And so then those could be forwarded to you, however y'all choose to do that, as a whole team or as a partial group or however.
So I guess there's not an urgency right now to make those decisions, because we won't begin to post it until September 1. But
You just need to come up with the ad.
correct.
But we would not start interviews till October.
Correct.
Right.
And so if we decide, we could have a 2-phase if we had the group, I guess Florida and her team would screen them, and then maybe,
One.
and then that would be their phase. And then we could meet to screen them. Maybe there's a meeting in between the regular board meeting, and then maybe, for time's sake purposes, just have a committee of 2. Unless the whole group wants to participate.
And then there's also the idea of opening up to maybe a member of the community, somebody else from the county in terms of things, in terms of the interview process itself. I think that's a consideration too. So the thinking we may be, after Florida does her kind of minimum qualifications, there's a group that looks at that group. And Jerome, jump in here. You're kind of a
You're our
HR
HR
guy.
guy.
And ultimately, maybe bringing a final couple candidates to the whole board. So anyway, those are the types of things we're gonna have to fish out.
I mean, are we open, or at what point do we need to think about if we're gonna consider any additional screening by a private consultant? Those type of things. I think we may have seen some information on a couple of vendors that does those type of screenings as well, more in-depth, more specialized.
Yeah, and the information that Ms. Elliott sent out prior to this meeting is that, and I think the thinking would be that once we made a decision about maybe our larger pool of applicants, that could be something we could use to maybe narrow it down a little bit. That was just kind of my thinking. So I think we all need to put on our thinking caps and kind of think through this process. And also be thinking about other, maybe, other people from this community or other people we'd want to involve in, and again, with the thinking is that the larger we make it, the more complex it's going to become, obviously, in terms of it. So anyway, those are my thoughts. And I think also, next month, we're going to have to figure out, if we're going to develop a board committee in terms of things and create a chair that would do that, that would lead this process. So just kind of organizationally how we're going to do it. So just food for thought.
And we can send you the draft that the consulting firm did when we hired Dr. Frazier of the recruitment advertisement. That's a very long, but you could take pieces from that, I think, and use that if you wanted to. Or I can do something draft and get it to you, whichever way you would prefer to do it, or Florida could review that and get you a draft. I mean, there are varieties of ways of doing that, depending on how involved y'all want to be in getting that done.
Yeah. Thoughts?
I mean, I would like to see what DSS's HR puts together, but I also would like to see, as you just mentioned, Jan, I mean, I want to see a couple of different pieces of information just to make sure it's robust and we're capturing everything that I think will serve us well.
Okay.
So maybe if you want to take a shot at it and pull something together and then circulate it to us, and then certainly with a target of knowing that we need to have this done by September 1.
Okay.
So
So I can send you what Developmental Associates did right away, because
Okay.
I've got that downstairs. At least I think I've still got it. So that would give you a start. I can send you what the state has as the basic spec page, and I know Mr. Dancy is aware that that's a pretty
Yeah.
bare bones spec kind of page, but it gives you the minimum qualifications of the E&E kinds of things, so that you can make sure that fits with whatever, and then we can start working on a draft, but that gives you some ideas of something to compare it to and to, does that work?
It does.
Okay.
Yes, it works.
okay, thank you. Good discussion. Okay.
And you may also want to consider county staff. If you all don't want to have an open or closed meeting and you do want somebody else involved in the process,
Yes.
maybe department heads or people
Yeah.
in social services.
Mhm.
Peer to peer.
Yeah. We'd already had some
we already-
conversations along those lines, the chair and I.
You stuck with me, so I need help.
Thank you, Brian. Okay, well, again, this is kind of going to be front and center for us for the next 3 months in terms of things. So don't want it to get ahead of us. And so I think we have I think in mind, we have kind of a timeline in terms of things that we're going to have to do. So. Okay? Okay, so we have a guest today. Next on the agenda, under items for discussion, we have Melissa Roop, and she's going to talk to us today about the Healthy Opportunity Pilot Project that Access East has received. Exciting, and look forward to hearing from it. Welcome, Melissa.
Thank you for having me today. I'm excited to share with you a little bit more about our Healthy Opportunities pilot. The pilot was received by Access East and will be servicing several counties in eastern North Carolina. The Healthy Opportunities pilot is a pilot that the North Carolina Department of Health and Human Services actually reached out to CMS and requested authority to use some of the Medicaid funds that the state received for this pilot project. And the pilot project that was approved by CMS allows us to test the success of using non-medical interventions to impact health. So what we're doing is we're using Medicaid funds to pay for health, not strictly health care. And we know that many of the people in eastern North Carolina do struggle with having access to stable housing, a stable source of food, transportation to not only get to doctor's appointments, but to pharmacies, to the grocery store to get the appropriate foods, that sort of thing. And then people who deal with interpersonal violence and toxic stress. So those are the 4 primary domains that this CMS waiver will allow us to test through the Healthy Opportunities pilot. It creates an opportunity for payers, providers, and human service organizations to actually have tools, infrastructure, and financing to be able to test these non-medical components to see how they impact health outcomes. And Access East was one of 3 organizations awarded funding throughout the state. The other funding sources, are the other organizations that received funding, is Community Care of the Lower Cape Fear, which serves the southeastern part of North Carolina, and Dogwood Trust, which serves the western part of North Carolina. But Access East is the one in this region that will be serving these counties, and we're so excited that we were selected to receive the funding and very excited to work with our community partners to really implement this project. Our geographic region currently includes 9 counties in eastern North Carolina: Beaufort, Bertie, Chowan, Edgecombe, Halifax, Hertford, Martin, Northampton, and Pitt County. We are still in conversations with the state. These are the counties that we initially submitted because based on the RFP, the communities had to be adjacent and we had to have partners in those counties ready to move when we were selected. The state is now going back and looking at this and we're having conversations with them. We may add some additional counties, but we will definitely cover these counties and potentially may cover a few more in eastern North Carolina as we finalize our plans. The proposed roles and responsibilities include several different people in this process. It will include the prepaid health plans that the state has approved. It will include care managers, the network leads, which is what we are. The pilot recipients are considered network leads, and human service organizations. Human service organizations we frequently refer to as community-based organizations that provide the services related to housing, food, transportation, and interpersonal violence and toxic stress. From a network lead standpoint, we really are the intermediary between the prepaid health plans and these HSOs to provide services for people and then to check over the invoices, make sure they're correct, make sure the services were delivered in a timely manner, send that information to the prepaid health plans, and once they approve that, they will send funding to the HSOs or the human service organizations for the services provided. We also are responsible for ongoing assessment of the HSO's performance. We provide capacity building funds to help our HSOs get up and going and ready for this pilot because we know that many of these community-based organizations may not currently have resources to increase their current workload. So we will be providing some funding provided to us through the state to help them get up and ready to go with this program. And then we will provide ongoing education and training for our human service organizations as well as our prepaid health plans. And you can see what other people's responsibilities are. The prepaid health plans are really responsible for approving people, community members, who are to be covered under the pilot, and the people covered with the pilot are Medicaid managed care members. There are additional criteria, so the prepaid health plans will be the ones approving the people for these services, managing the funds, authorizing the services, and then paying the human service organizations. And then we have care managers who will actually be referring people to the prepaid health plans and then referring them for these services and following up to make sure the services are provided. And then the human service organizations, they have a big role in delivering services to our community members, making sure that they do that in a timely manner. They partner with us on the invoicing process and on ongoing quality improvement and quality assurance measures to make sure that we are tracking not only the outcomes for patients, but also the services that are provided to make sure they're able to provide those in a timely manner. Our first 18 months of funding is considered capacity building funding, and initially it was a 2-year period, but we were delayed. We submitted our proposal in 2019, 2020 timeframe, early 2020, and because of COVID that happened right after we submitted it, the proposal was delayed for almost a year. And so now we are a little bit shorter on time, but the first 18 months, we will receive funding to help develop our own division within Access East to manage this program and all of the services that we'll be providing, and to also help our human service organizations with capacity building, helping them get up and going, making sure that they have the computer software necessary to track the services that they're providing and to bill us and provide education before we actually start the delivery of pilot services. So again, our focus for the first year is really on that HSO network development as well as our own development. There is a lot of information systems, technologies that we have to develop, create, deploy to be able to manage this project. We will be providing a lot of support for any community-based organization who wants to participate. The state does have several requirements for community-based organizations who want to participate, and then we will be working with them to determine what their needs are. And then going ahead and setting up the governance, the ongoing monitoring of those services, and being ready to implement. A huge part of this is community engagement, and so that's why I'm excited to talk with you all today and let you know what we're doing. We will also be having several community engagement meetings over the next 4 months in each of the counties that we will be serving to talk with community members, to not only share with them about this program, but to get their feedback as well, because it is very important for us to understand what challenges our community members experience and where they are receiving great services now to make sure those are included in our network. Our service delivery is scheduled right now to begin in February of 2022, which is coming very quickly. That is a little bit dependent on several of the functions that the state is currently working on now. We will have to make sure that we have a finalization of the process and the technology to handle the invoicing. Right now, the state is working through one of our vendors that Access East uses and many other organizations use throughout North Carolina, NC Care 360, which is a program and a platform to connect people to resources and services in the community. They're building the invoicing component, and so we are anticipating that will be ready by January, but if for any reason there are delays, it could potentially delay us some, although we're not anticipating any significant delay there. The other piece is training and preparation of our human service organizations. As we continue to move forward, we may find that there's additional training that they need that we weren't thinking about, and so that could potentially delay that start date. And then the other piece is really working with our prepaid health plans on their role in this. We've had some conversation with them, the state has been working with them, but there's still several areas that we need to clarify related to their responsibilities and how that fits with us and our human service organizations. So the tentative deadline for starting is February 1st of 2022. But I say it tentatively because it may not go until March of 2022. It will go in 2022. I feel very certain that it will go in 2022. So if it doesn't start exactly on February the 1st, we will certainly keep you all updated so you know when it will start. But we will be up and going in 2022. And we're very excited about bringing those additional resources. So the main thing that we are working on right now, there are lots of components that we're working with the state on, but the key piece is engagement with our human service organizations. We want to make sure that they have plenty of time to ask questions, to understand what their role will be, to apply and go through the application process so that anyone who meets the state qualifications to be a human service organization is prepared to go when we launch. So there will be an application. We're hoping to have that application available beginning September 1. We've already submitted our draft application to the state, and pending state approval, we will have it ready by September the 1st. If there's any change or the state makes any modifications that we have to talk through, it could potentially be later, but our goal is to try to have the application out September 1st and have it available at least through the month of September for organizations to apply. It's a pretty straightforward application with the name of the organization, what county they serve, how long they've been in existence, are they not-for-profit, just basic questions to help us make sure they meet the minimum state criteria. And then, as long as they meet the minimum state criteria to be a part of our network, then we will begin the assessment process. And the assessment process really is conversations either on site or virtually or by phone, depending on where the organization is. They will talk with our assessing faculty or staff. We've contracted that service out with ECU, and so they'll be helping us with the assessment process. Through the assessment process, they'll help us determine what additional support the organization needs, what funding or additional capacity building they may need to get them up and going. An organization that's already using Insecure 360 and already very well partnered with the community will not need as much support as an organization who already doesn't use that, who may need some additional computer technology or other support to get up and going on that system. So we'll work through the individual details that way. Once we determine who the organizations are that meet the criteria, we determine what their needs are, then we'll submit that list to our governing body who will approve all of the organizations who are part of our HSO network and the capacity building funds, and the funds will be distributed at that time. Following that piece, we'll begin doing education and ongoing support to get those organizations ready to go by February the 1st. So that's where we're at right now. We are still doing a lot of discussion with the state and sending documents back and forth to get their input and to make sure we have all the components necessary to share with our human service organizations and to make sure we're ready to go by that February 1st target date. We will certainly continue to share any other updates since we get those, and we will certainly keep you all updated when we're ready to implement the service. Do you all have any questions at this time?
I have a question.
Mhm.
Is there a limit to the number of organizations that can be involved?
No, ma'am. We are thinking that we're probably gonna have somewhere between 50 and 100 organizations, but we're gonna have to see how many organizations apply. We do have several organizations who've already submitted letters of intent, and so we'll certainly get the application out to them, but any other organizations that meet the state criteria, and there's several criteria, but it's not based on size of the organization. It's not-for-profit status, making sure that they didn't just start 2 months ago, that they have, the correct leadership, but there is not a limit. So if there are organizations that you all know of, feel free to send them our way, and we will be happy to get them an application. We will, again, be sharing that at the community level as well.
And each project site will have a full $10 million, or are the three projects splitting $10 million?
The state actually got about $650 million. Most of that money is slated to pay for the services. And each organization that received funding submitted their own budget. So we know how much we received, but each organization received different amounts based on their proposal. It's my understanding that the total of the three organizations received somewhere under $100 million between the three, but I don't know how much each organization received. But we are not splitting $10 million.
Okay.
We got some money to do this work, and we're very thankful to the state for that.
What type of professionals or paraprofessionals do you think you'll be employing through Access East for your part?
Right. For our part, we'll be employing an administrator, we'll be employing 3 managers. One will have a financial services background, and they'll have staff to help them with the invoicing piece. We'll be hiring information technology or information systems manager and people to support them with the technology that we need to be able to track all the different components. And then we'll be hiring someone who will be the manager of the human service organizations, and they'll have team members reporting to them that will go out and work with each of these organizations to make sure they're up and ready to go and continue to work with them, because we anticipate the first 2 years will really be a huge learning process for all of us. So those are the people that we're looking at hiring right now, and we're continuing to learn as we go as well. But information systems, financial services, and then someone who has really good experience in the community working with these community-based organizations is who we would be looking for.
Thank you.
Sure.
Other questions? Well, thank you, Melissa. And
Right.
what I was thinking
Thank
as you were talking, maybe a couple months from now you can come back.
Yes.
I think that would be good. I mean, we can help you get the word out, and so we'll put you on a rotation. How's that?
That sounds great. That sounds great.
Good.
We're learning more every week, so I do think I will have more to share as the months go by, so that
That's
will be
wonderful.
fun.
Okay, well, good luck with your project, and
All right.
we will see you in the future.
Thank
Thank
you.
you.
It's a huge project.
Okay, next, we're going to hear from Dr. Frazier, and he's going to give us an update about the CDBG CD grant and Medicaid transformation. Transportation. That too, that's right. Thank you,
Somebody
Melissa.
said, the only one is driving, the other one is. Good afternoon. I sent you guys a one-pager of my report, and I want to say thank you to DHHS for the rollout of the Medicaid transformation. They have done a phenomenal job, and they have been able to put a lot of structures in place to either troubleshoot or make sure the challenges that are coming are resolved very, very quickly. They have also set up daily meetings now so that these challenges at every level is handled and resolved very quickly. So, that said, they are now focusing on the Medicaid tailored plan. That plan will service between 7,000 and 7,500 of the population that may have inadvertently enrolled into the managed care plan. So hopefully the letters have been mailed out to this population who may receive further counseling and be enrolled into an appropriate plan that is called tailored plan, so that they can become serviced and receive care. So what is the tailored plan? The tailored plan is a plan that is carved for people who with severe behavioral issues and mental and developmental challenges. So those are the people who will be focused within that group. So after counseling, if they decide they want to stay with the managed care, then they will be placed under a special group called the Transition of Care Protection. That is a group that will have priority in the services that are provided within the managed care. Any questions on the transformation? So CDBG, we are continuing to make steady progress in the utility assistant. As of Friday last week, we have spent $29,225 on utility assistant, and we are targeting very low, and moderately low income earners. And that capture is between 64 participants thus far that we have serviced. And I'm very grateful for this, so that we continue to provide for our community those who need help. So the rental assistant, we have changed the structure. We have eliminated any barrier and almost all barriers. So the qualifying criteria is your request must be COVID-related, period. And once that is done, you support it with documentation, you will be considered for the grant. As of today, as of our last meeting, we received 3 additional requests, applications, and those are under review currently. Hopefully, these reviews will be completed by this week. Against next week, I'll be able to give you guys update, or if you want, I can send those updates to Ms. Jan, who may forward you those before the next meeting. There has been significant increase in inquiries about this program. The press is also very interested, and we are thankful for the word getting out there so that people of Greenville and Pitt County will benefit from this utility and rental assistance program. If you have any questions, I can entertain those now.
I think, excuse me, I think in your notes, didn't you have quite a few that withdrew their applications?
That's correct.
And was that due to the fact that they were not COVID-related?
Either they were not COVID-related or their income was higher than the threshold.
Are those folks still at risk of losing their
Well,
rental?
that will depend on a lot of issues because there are other programs within the county that is also helping those
Right.
out of our
Yeah.
bracket. So they are referred to those programs as well.
Okay. Any, I think last month you mentioned you were working with landlords and partnership. How's that going?
Well, I mean, it's still ongoing, the dialogue is still ongoing, and our partnership is still very strong. We did not hold up the meeting tomorrow because of logistical issues, but that is going to continue next week.
Okay.
Dr. Frazier, do you continue your work with legal aid? Are they a part of your formula? Are they referring people to you?
Yes, Chair.
Dr. Frazier, can you remind me again what CDBG stands for?
It's Community Development Block Grant.
Okay, sorry.
I'm sorry, I should have make sure the acronym was spelled out. I apologize.
No, I want to thank you for your work on this, Dr. Frazier. I've been involved previously in terms of these efforts, and a number of people have put a lot of work into this, I know. And there's an ongoing need, and so I appreciate what you've done with this.
Thank you.
Okay, Ms. Jan,
Okay, so
go ahead.
we're ready to talk about the Medicaid application processing report. And unfortunately, we struggled this month with the MAD applications. They were not successful in processing them within the time standard. We had several applications, and again, it's a fairly small application pool, but we had several applications that went beyond the time standard, and that was down enough to make us to drop to 85%, and we needed to be at 90%. As you see, our other Medicaid still is above the 90% mark, so we're doing fine there. And again, as a reminder, it is 3 months consistent or 5 months out of 12 before you get into trouble. So we are not in any difficulty, not in any, people understand there's gonna be a month here or there that things can happen. You can have people out, you can have a disaster, other things happen. So we are good. So then if you look at our average processing time, again, we did not go up significantly on our average processing time for either of our MAD or our other Medicaid. They stayed right within line of where they were supposed to be. So even though we did not process enough applications timely, our average processing rate did not change dramatically. So staff are on target now. We know what the problem was last month. We are addressing the problem for the coming months, and so I do not anticipate having any additional issues. I think Brian's still there. If Brian has anything to add, certainly he can do so.
You're on target with that.
Right, right. So, any questions from anybody? Okay. So, our vacancy report. As you met, we have 3 new folks on board. We have 35 vacant positions. 20 of those are in services. And you can see that we have 13 that we're interviewing, 4 we're waiting background checks, 8 we're screening. So we have only 2 frozen, so staff are moving steadily towards trying to hire these positions. And certainly this is part of the regular turnover that we've experienced during COVID, because it has, I think, affected folks. We've had some additional turnover as a result of all the stress that folks have been under. And then you add the wonderful 12.5 positions that the county provided to us. And so that has taken. And I will say that in some areas, we are struggling to get enough applicants. The social work applicants are still, not a large number of social work applicants. So we continue to search for those folks, and in some cases, it's been difficult, so we're having to re-advertise occasionally. So that's what's going on with our applications. I think overall, things are moving along. I'm pleased with where we are. We've been working hard. More still to be done, certainly, but folks are working hard and trying to do what we need to be doing. So with that, I will point out, we do have some upcoming events. It's Brady Bear time again.
Oh, is that again?
Yay! So any of y'all who want to go help and make a bear, they'd love to have you come down there. We'll share more about that. I think the 17th is going to be Media Day, and then the following week, we're all actually going to be out there and eating bread and making bears and buying bears. So get your bear orders ready, and it does a wonderful thing to support our foster children and those at risk of coming into foster care. So we certainly appreciate this partnership for sure. Child Support Awareness Month is ongoing. Dr. Frazier managed to go to the big walk. Unfortunately, I did not make it that day. They have a lot of good things going on, and so they want to come report next month on what they did. I will say that we have a shout out to one of our child support agents who collected over $16,000 in one lump sum. I think she was like number 5 or number 6. So Angela Simpkins, we are so excited to have Angela to have that opportunity to make it in the top 20 in the state on collections, in 1 month collections. So anyway, so that's my report for this month. If anybody's got any questions, I'll be glad to answer them.
Questions for Jan? Okay, if not, board member comments. Anybody like to make any comments as we close out our meeting? We have a quiet bunch today. Okay, well, if there's no comments, I will ask for a motion to observe, to cease the meeting.
Motion to adjourn.
Adjourned.
Second.
Can I have a second?
Second.
Did you get that, Susan? Dr. Bunch? All those in favor say aye.
Bye.
See you next month.